Hello and welcome to this special episode on the laser treatment of piles. With me in the studio is Dr. Vardhan Bhobe, a renowned laparoscopic surgeon with profound experience in the treatment of piles. Welcome Dr. Vardhan to the show.
Thank you.
So Doctor, what is piles?
Piles in simple words is nothing but a dilated blood vessel.
Okay.
So there are certain blood vessels within the rectum from where we pass motions.
Right.
And these blood vessels, due to some reason, they get dilated.
Okay.
Once they get dilated, sometimes it bleeds. And this is what is called as piles.
Right. So is there any other condition that can mimic the condition of piles?
Yeah, there are many conditions which can mimic piles, like in our OPD, commonly anything which bleeds and pains in the rectum is misinterpreted, I would say, as piles. But unfortunately, almost 50% of the time it is not piles. So there are other conditions like fissures and fistulas, and most important, which is an extremely common disease unfortunately nowadays, is carcinoma of the rectum. That is cancers of the large intestine, especially on the left sided, and the lower colonic cancers. All this basically present with a first hand presentation of piles, of bleeding, and sometimes pain associated with it. So we have to be very careful when the patient says that, okay, I have come with piles. Unless and until you properly examine this patient, we may be dealing with something else.
Right. So doctor, what are the conditions in which you can bleed per rectum?
Commonest condition where a person bleeds is because of piles.
Right.
Almost like if you see 30 to 40% of our OPD practice nowadays is related to piles, and it is extremely common, and when history is for many years duration, you can almost be certain that it is piles itself. But we should be very careful in patients who are especially more than 30-35 years of age, where even, as I said, cancers of the large intestine, especially of the rectum, can present with bleeding, and exactly like condition of bleeding
be piles,
and
but
it
you
could
would
be
not.
piles. In fact, the patients are totally well preserved and they don't have other symptoms relating to the cancers.
Cancer.
And unless we do investigations, it's
You
difficult
won't
to
know
say
that
whether
it's
it is
something sinister.
piles or cancers of the rectum.
Right. So doctor, what is the precursor of piles? I mean, what leads to piles?
So if you see nowadays, you will also agree that our lifestyle has completely changed.
Absolutely. Yeah.
So what I remember as a child, we were sleeping quite early, getting up
Yes.
sometimes late,
And there was no Netflix and
there
all
was
this
no
kind,
TV,
no social
and
media.
yeah, hardly any TV also. So we used to play a lot in the evenings, and we used to drink a lot of water. Our parents used to tell us, drink, drink, drink,
Yes.
and we used to drink a lot of water. Nowadays, there's a sea of a change. So
Right.
if you see, our lifestyle is more, I would say, is of stress type,
Right.
So there are now professions where you hardly get sleep.
Yeah.
And there are all, night duties in
Right.
some professions where you don't sleep in
Don't
night
sleep
at
in
all.
the night at all.
So this causes a very severe diurnal variation and leads to constipation. And constipation is the basis of piles. Most of the patients, if you see, is constipation, which causes a very severe variety of constipation causes piles. Other causes may be which are contributory to it, like maybe lifting heavy weights, then even conditions where patient has got prostatic enlargement and they use pressure to pass motions can also present in one way or the other as piles.
Piles. So that is in male patients.
In male patients, yes.
Right. So doctor, are there stages of piles, or is always bleeding piles that presents for a patient?
Yes, I would like to show you a small small presentation where I will show you what are the stages of piles.
Okay.
As we can see over here, in the first stage of piles, you can see that this is where the motions are coming out. Somewhere around 1.5 centimeter inside, there are blood vessels which are bunched up. Okay, so these blood vessels, when they get dilated and cause bleeding, that is the grade first of the piles. Okay, so here when the patient passes motions, they don't come out, they are just there. In the second stage, if you see, the piles have become bigger. So what happens when the piles are bigger, the patient, when they pass motions and they strain, the piles come out and they reduce back when the motions are over. So this is called a second variety of piles. So in the third variety, if you see, these piles are getting bigger. So these piles come out and hardly ever reduce after passing motion. So some people use a finger to manually reduce it. So this is grade 3 variety of piles, and grade 4 variety is a massive piles. So if you see here, the piles has completely come outside. So there is no need for the patient to pass motion. You can immediately see that the piles are outside. So these are called as grade 4 piles. So see from grade 1, which is totally internal, to grade 4, which is totally external. Now there is a small variety called as external piles, where at this opening of the rectum you get swelling here. So no, as I told you, these piles were at 1.5 centimeter inside. So external piles is something where you get swelling of the veins associated with the anal verge, or where you pass motion. So these are basically the types and stages of piles.
Right. So doctor, can we say that any swelling or mass in the anal region is always piles, like, because in grade 3 and grade 4 the mass is protruding outside? I
would be happy to say yes, but unfortunately the answer is no. So many times, as I said, I would say the most important diagnosis that we need to rule out is cancers of the rectum and the large intestine. These should not present. Sometimes the cancers of the rectum are so big that they come down and they present as masses. Sometimes you get cancers of the anal canal as well. So if these come out, the patient feels that something has come out, it is piles and it bleeds, but most likely it is not. So you have to investigate these patients and rule out cancers in this patient, and then only we can say that all the swellings down are piles.
So seeking medical help at the right time and getting yourself evaluated will tell you whether it is piles or it is cancer.
Absolutely certain. It has to be done at the right time, and I would say when the patient has had symptoms relating to piles, at least once the patient should go to a surgeon, get himself examined and confirm that it is piles and not anything else, and probably take the treatment from there on.
Yeah, because I think it doesn't involve much test, just a simple surgeon
Absolutely
visit.
Not. It is an OPD level visit where we check and
where you don't have exorbitant tests to
absolutely,
do.
Absolutely.
So doctor, can we say that piles can lead to cancer? Is there any condition like that?
No, not at all. Piles are just dilated blood vessels, and they can almost never change into malignant condition. They are always non-malignant.
Right. So doctor, now coming to what are the symptoms of piles? How would somebody know that they could be having piles and seek medical help?
I would rather say that there are two very important symptoms which are very harmful to the patient, and everybody should be aware of. When a patient says that he is having bleeding and that too for many years or many months together, what happens is the patient loses quite a lot of blood from the rectum. Sometimes it is so much that the hemoglobin of the patient can drop down to 5 or less than 5. So I have had patients who have presented with hemoglobin of 2. So literally they don't have much of blood reserve left in the body. And these patients present with a direct pressure on the heart, causing heart failure. So patient presenting with heart failure with a low hemoglobin, first thing you have to see whether this patient is bleeding because of piles. And many patients do present in our type of population. Second, I would say is pain when the piles are very large variety, as we said, grade 4 piles, when the piles has come out, especially when the piles have become very big, they become sometimes thrombosed, they become blocked, and they cause intense pain, and that's why they present in an emergency condition with painful swelling at the rectum, which is called as prolapse thrombosed piles.
Right. So doctor, how would you diagnose piles?
First and most important, once the patient comes, it is very important for us to examine the patient locally. There is something called a proctoscope, where we insert the proctoscope and see the stages of piles, whether it is 1, 2, 3, 4. If patient is having recent history of bleeding per rectum, most important, as I said, because in our type of population, cancers are very common. So I would probably advise a colonoscopy for all such patients with recent history of bleeding. Also, patients of 60 years of age who have had very small episodes of bleeding in the past, but suddenly they present with large episode of bleeding, we have to consider a colonoscopy in these patients,
Right.
and other tests like blood tests to check what is the hemoglobin level, and an ultrasound is a must to see where we stand in this
Yes.
patient.
Because an ultrasound will help you to rule out other conditions. If it's a
Yes.
female patient, there could be other reasons that the patient is bleeding also.
What
not
we
per
didn't
rectum.
touch upon is conditions called as ulcerative colitis
Yes.
and Crohn's disease,
Yeah.
which also can lead sometimes to severe bleeding. They cause small ulcers all over the large intestine,
Right.
and they are autoimmune diseases, and sometimes patient presents with intense bouts of bleeding 7-8 times with lot of pain and cramps in the abdomen and fever.
Right.
So these are classical of something called as ulcerative colitis.
So, doctor, is piles a painful condition, or it is just a swelling that you won't have any pain?
So let us say it is like this. Painful condition arising from the rectum is almost never piles. Okay. Why? Because piles is just a dilated blood vessels. It is supposed to bleed. Unless it is very big and thrombose, as we said, then it's going to pain, but very rarely. So mostly ever the pain is not there in such patients.
Right.
If there is pain, we should rather think of a fissure in ano where there is a cut in the rectal mucosa, or sometimes patient can present with a large abscess which is ruptured into the rectum, something called as a fistula, and these conditions are more common to cause pain rather than piles. Piles, I would say, is mostly painless bleeding. Patient goes to the bathroom and passes lot of blood in the pen, and you suddenly get up and say, oh my god, there is a lot of blood. That's exactly how the piles patients present.
So, doctor, in your practice, have you seen a prevalence of piles in a particular age group or a gender?
Because of what we said, that our lifestyle changes, and now even children and all don't pay attention to the food habits at all. Like
vegetables are completely out from our
they don't know what are vegetables.
Right.
Because the taste of pizza and burgers and all fast food is very tasty. We also have it, but we don't have it every day. We will have it maybe once a week, twice a week. So the habit of food habits of children have changed. The food habits of elder have changed. Now people have become more financially sound, so they can buy better things in life. But finally speaking, unless and until you are rooted to nature, you will suffer from piles. So that's why I would say that people from age group of as less as 15 to age as much as even 70-80 can present to piles. So there is no age group now left where we say that okay, this is the age group of piles. Anybody comes nowadays with piles. And regarding the gender, it is common with both.
Right. So, doctor, I very often heard that consuming spicy food or pungent food could lead to piles. Is this a myth, or is it actually a causative factor to this?
No, the consumption of spicy food and all would be more related to pain in acute fissures in the rectum rather than piles. Piles as such are painless bleeders, so that's why they are not very common conditions when it pains, and especially when consuming such type of food. So fissures, yes, will have sudden exacerbation when a person has very spicy and pungent things.
Pungent food. Okay, so doctor, what is the treatment options for piles?
Most important, and as a surgeon, I would say first thing that is required is a conservative management. The food habits and dietary changes and the lifestyle should completely change. A person requires a good rest. A person requires a good exercise. Mind you, the exercise is extremely important, around half an hour, 1 hour a day, maybe 4 to 5 times a week. And consumption of lot of fibers is very important. Very simple to have salad twice a day.
Right.
And fruits like banana, papaya, watermelon add to having good motions and fibers to the fiber and to the motion, and helps in passing a lot of soft motions. And yes, around 2 to 2.5 liters of water minimum, and in times of summer heat like this, maybe around 3 liters. Yeah. So this is the first line of treatment. Always, I mean, even though surgery may be indicated in the patient, first line of treatment is always conservative and change the lifestyle, because it is going to help even post-operatively.
Right. Doctor, so this is conservative.
Yes.
Medically, what is the treatment of piles? Is there some medical options or is it surgery only?
Added to this, there are some medications like flavonoids available which will slightly shrink the piles. So, if the patient, as we said, in stage 1 variety or stage 2, early stage 2 present with piles, we can probably try these medications and change of lifestyle and food habits. Maybe they will work and patient does not require surgery.
Right.
But in advanced variety of stage 2, stage 3 and stage 4, these patients require some form of surgical therapy and not only medical therapy, because medical therapy is bound to fail and patient comes recurrently with bleeding and all. So, we need to take care of that as well.
Right.
You know.
So, surgically, doctor, what is the treatment for piles that is recommended?
In stage 1 and stage 2, since these piles are small, we can probably do a rubber band ligation or you can do an infrared coagulation.
Okay.
In stage 2, 3 and 4, treatment is slightly advanced because these treatments what I just described are bound to fail. So, here either we do a conventional open surgery where the piles are physically cut, you know, and the wound is left behind.
Excised, yeah.
Second is doing a stapler hemorrhectomy where a part of the intestine of the rectum which supplies the blood supply to the piles is cut off so that the piles shrink. And third and the most effective and very easy to perform nowadays is the laser ablation of piles.
Right. So, doctor, tell us more about the laser ablation or the laser treatment for piles.
To tell you very clearly, laser ablation of piles is like, let us say, you know, some guests are coming and you have to prepare good dinner and all for this patient. It's going to take you half a day, you know, to prepare, first of all, to get everything from market and all.
Right.
Laser surgery is like 2 minutes Maggi noodles.
2 minute noodles.
Prepared, ready, eaten, out. That's
Right.
it, you know.
Okay.
So, laser surgery is where you are giving energy through a machine, there's a laser machine, and it is given directly to the blood vessels which are supplying the piles.
Right.
So, they will shrink in the next 10 to 14 days after applying the laser.
Right.
And that's how the piles are taken care of. All varieties starting from 1, 2, 3 and 4 can be completely
treated
taken care of by laser. And as I said, we are just applying the laser energy. So, there is no question of any cut. There is no question of hardly any bleeding.
Right.
So, there is no pain because there is no cut.
Correct.
Pain is related to the amount of cuts that we give. When there are no cuts, there won't be bleeding, there won't be any pain. So, hardly any pain, and the procedure is so fast that within 10 minutes the procedure is over. So, patient comes in the morning for surgery, gets this done, by afternoon he is out. So, he does not even realize that, oh, and he is back to work in the evening if he or she wants.
Right. So, doctor, as you said, looks like that laser treatment of piles is the most preferred option in treatment of piles, as in grade 3 and grade 4.
It has come up now in the last 4-5 years where it is being used for more and more patients. So, the data suggests now that this treatment is the best option at the moment available for all patients who are suffering from piles. What happens? Patients are hesitant to come to a surgeon because, oh, they have to undergo surgery. Now they have to get cut and there will be pain and all. So, this is like a paramount shift in the treatment of piles. Where you are just using laser energy to burn it, shrink it and take care of the piles. So, the piles is gone.
It's almost like a visit to a salon.
Absolutely.
Go get a haircut and come back
I would say
home.
go to the visit to a salon.
Right. So, doctor, are there any complications in the laser treatment of piles?
Yes, just like there are complications in any form of treatment, whether it's open surgery or stapler, or the laser also has got 1% chance of probably bleeding, infections and abscess formation, but it is less than 1%. If the procedure is done correctly and it is used for the right conditions, then hardly ever, at least I have never seen any complication happening, touch wood, to any of my patients.
Right. So, doctor, after surgery, what is the next course? Will there be a recurrence in the piles, or is there some kind of precautions that the patient needs to take?
Very, very important question. Rather, this is the important question in the minds of all the people who come to me, and they think that, oh, I'm getting operated. So, is it permanent? and
Will it come back
will
again?
it come back again? But to tell you, a surgeon or doctor is not a magician.
Yeah.
It's not that he has done and everything is over. Most important is for the patient to follow the dietary restrictions, as we said earlier, all over till for the whole of our life. Why? Because as we said, the cause of the piles is straining, causing constipation, pressure on that area. So if even after the surgery, whatever form, whether laser or any other form, again the patient starts having the same problems again, it is going to cause pressure on that area and it is going to cause piles again. So if a patient takes care of all the dietary habits and everything, then definitely the patient should not be getting these piles again. So definitely the onus is on each and every patient to follow certain changes in the lifestyle, and I am sure they are not going to get piles.
And by certain changes, I think you mean that patients should ensure that they are not constipated, because constipation
Absolutely.
directly leads to this condition.
Constipation is an enemy to a patient of pile. Let us put it that way. It's like a terrorist.
Correct.
So that enemy should be thrown out of the body. Even if there is a day of constipation, immediately they should take some laxatives or something like that.
That will
so that
relieve them.
the constipation is not for a longer period of time and it will not lead to piles. And let us say in a rare condition where patient has got recurrence of piles, then this laser surgery can be done again. Again it is painless and the same
There is no
fast.
blood loss, there's
Not
nothing.
at all. It's
But that
very
doesn't
good.
mean that the patient should not change his
No,
food
no,
habits.
a patient should not like undergoing the surgery again and again.
Right. So what you actually say is consuming a good balanced diet, not only exclusively vegetables and not exclusively non-vegetarian food,
No,
but a balanced mix of
absolutely.
everything.
I would never. I always tell the patients that they can eat all the fish and the eggs, meat, and everything. There is no problem. But along with that, 1 or 2 portions of, vegetables is extremely important.
And fruits as well.
Consumption of water.
Water.
We should not lose the significance of water.
And like you said, physical exercise.
And exercise.
A simple thing
Half
as
an hour,
just
45
walking.
minutes is important. We can never say, we give sometimes a bad excuse in our life. No, I don't have time and I don't. If your time for work 12 hours a day, I'm sure you will have half an hour or 1 hour's time for a walk.
That is an excuse that is mostly.
It is more of an excuse rather than anything else.
Yes. So, doctor, the laser that has been used in the laser treatment of piles, is it a
Yes.
a big equipment, or is it a small equipment like a microscope that you can carry anywhere, something like that? What is it exactly?
It is in fact the smallest instrument I have ever seen in the surgical experience. You know, it is so such a portable machine. It may be just like a glass of water.
Okay.
It is that small, and there are small fibers which transmit the current.
Right.
So this machine is kept when it is not being used in a box, in a bag, and this bag is stored in a proper place. So this bag can be taken anywhere if you want to multiple hospitals, and they can be used at any place. It's not that it requires a special light connection or something like that. It is not at all. You just require those fibers which are always available with the laser, and those laser fibers also are extremely small. So they are so very portable and so very user friendly that nobody can misuse these things. They are very, very simple and user friendly, basically, all these laser machines.
So, but I think you need an operating an OT to do it because of the aseptic precautions that need to be taken.
Of course, 100%.
I mean, you won't be able to do it on an OPD basis.
No, and sometimes what happens, because of this area being little delicate area, little painful sometimes, because patient is little uncomfortable when the procedure is being done, then we can give a little bit of sedation to the patient or a spinal anesthesia, so patient is comfortable. See, no procedure should be at the cost of anxiety of the patient. And cause more anxiety
to the doctor.
If both ways. So it can cause unnecessary bleeding if suppose you fire the laser somewhere else. So we should be totally relaxed in our mind, and the patient should be relaxed, and we can use the laser at a specific point, because see, it is those specific points which have to be burned. If we burn the laser somewhere else, it's going to cause an ulcer and problem, perforation, abscesses and all that. We don't want that. So patient is comfortable, doctor is comfortable, 15-20 minutes surgery is over, and there you have the results. So.
So, doctor, as we come to the end of this episode, what would be your take-home message to our viewers on piles and the laser treatment of piles?
First of all, I would like to tell all my brothers and sisters that piles is not something that anybody should be worried, and not worried to the extent that they should not come to the doctor to show whether they're suffering from piles at least once.
Right.
So I would say at least get yourself examined by a surgeon who will do a proper proctoscopic examination and rule out whether the patient has got piles and or no. As I said, there are other conditions which we mimic piles and cause bleeding. So we don't want those conditions to be there, and we are treating piles where the patient is suffering from something else. And if there are cancers, we need to detect them early.
Right.
And once these piles are detected, most important is conservative management. Patient brings about change in dietary lifestyle and food habits, exercise and all that. And if you ask me which is the best surgery, if I have piles, what I would undergo, I would say laser surgery, because it is simple, straightforward, painless, no bleeding, very fast recovery, and patient is in and out, so you are back at your work the next day.
Right. So, doctor, thank you so much for taking time out from your busy schedule and giving us an inputs about piles and the various treatments available, especially laser treatment that you are having so much experience in. For those viewers who have problems of piles and would like to seek consultation, Dr. Vardhan Bhobe is available for consultation at RG Hospital, Goa. So go ahead and book your slots. Keep watching Prudent. Thank you so much.
Thank you.